In this video, we are going to see about the cardiovascular diseases. The cardiovascular diseases are leading cause of death globally. An estimated 17.9 million people died from cardiovascular diseases in 2019, representing 32% of global deaths. Of these deaths, 85% were due to heart attack and stroke. Over one-third of the cardiovascular disease deaths take place in lower and middle income countries. Out of the 17 premature deaths under the age of 70 due to non-communicable diseases in 2019, 30% were caused by cardiovascular diseases. Most cardiovascular diseases can be prevented by addressing behavioral and environmental risk factors such as tobacco use, unhealthy diet, and obesity, physical inactivity, harmful use of alcohol, and air pollution. It is important to detect cardiovascular disease as early as possible so that the management with counseling and medicines can begin. Some of the commonly occurring conditions of heart diseases include the stroke and cardiovascular diseases. The cardiovascular diseases are a group of disorders of the heart and blood vessels. They include coronary heart disease, a disease of blood vessels supplying the heart muscle, cerebrovascular disease, a disease of the blood vessels supplying the brain, peripheral arterial disease, a disease of the blood vessels supplying the arms and legs, rheumatic heart disease, damage to the heart muscle and heart valves from the rheumatic fever caused by streptococcal bacteria, congenital heart disease, the birth defects that affect the normal development and functioning of the heart caused by malformations of the heart structure from birth, and deep vein thrombosis, a pulmonary embolism and pulmonary embolism, the blood clots in leg veins which can dislodge and move to the heart. The heart attacks and strokes are usually acute events and are mainly caused by blockage that prevents blood from flowing to the heart or brain. The most common reason for this is a buildup of fatty deposits on the inner walls of the blood vessels that supply the heart or brain. Strokes can be caused by bleeding from a blood vessel in the brain or from blood clots. The risk factors of cardiovascular diseases are unhealthy diet, physical inactivity, tobacco use, and harmful use of alcohol. Amongst environmental factors, air pollution is an important factor. The effects of behavioral risk factors may show up in individuals as raised blood pressure, raised blood glucose, raised blood lipids, overweight, and obesity. These intermediate risk factors can be measured in primary care facilities and indicate an increased risk of heart attack, stroke, heart failure, and other complications. There are also a number of underlying determinants of cardiovascular diseases. These are a reflection of major forces driving social, economic, and cultural change, globalization, urbanization, and population aging. Other determinants of cardiovascular diseases include poverty, stress, and hereditary factors. Symptoms of heart attacks. A heart attack or stroke may be the first sign of underlying disease. The symptoms of heart attack include pain or discomfort in the center of chest or pain or discomfort in the arms, the left shoulder, elbows, jaw or back. In addition, the person may experience the difficulty in breathing or shortness of breath, nausea or vomiting, lightheadedness or faintness, a cold sweat and turning pale. Women are more likely than men to have shortness of breath, nausea, vomiting, back or jaw pain. The symptoms of rheumatic heart disease include shortness of breath, fatigue, irregular heartbeats, chest pain, and fainting. The symptoms of rheumatic fever include fever, pain, swelling of joints, nausea, stomach cramps, and vomiting. Prevention. The patients with cardiovascular disease should have access to appropriate technology and medication. Basic medicines that should be available include aspirin, beta blockers, angiotensin, converting enzyme inhibitors, and statins. An acute event such as heart attack or stroke should be promptly managed. Sometimes surgical operations are required to treat cardiovascular diseases. They include coronary artery bypass, balloon angioplasty, valve repair and replacement, heart transplantation, artificial heart operations. Medical devices are required to treat some cardiovascular diseases. Such devices include pacemakers, prosthetic valves, and patches for closing the holes in the heart. Thank you.